thank you very much, Emma, for organising, and let me introduce myself. So I'm a commissioner with Yorkshire and Humber Climate Commission, and we are a network across the whole of Yorkshire, looking at how we can drive down carbon emissions. And the wonderful Rosa, who's also on the call, will give you a bit more of a go. She's a co-director with Yorkshire and Humber Climate Commission. So I'm also a health leader. I'm a Yorkshire, I work for the Yorkshire Ambulance Service, and I'm also the Net Zero ICS lead at the moment for Humber and North Yorkshire as well. So there's lots and lots of things that are going on, and Yorkshire and Humber Climate Commission are helping to drive forwards a lot of cross-sector agenda. So this is where technology is going to completely and utterly fail on me. So I will try and attempt to get a video to work. Can you imagine? So just bear with me a second, and I will beat my computer up. Yeah. So I'm going to press the magic button, include computer sound. Right, okay, here we go. So should be able to see that, Emma. Yeah.
Yeah, we can see a presentation.
Fab. Right, okay, so Yorkshire and Humber Climate Action Plan is a wonderful plan that we've put together as a group of commissioners across the region. Now, this is where I'm going to have the challenge of getting technology to work. Got it. Fantastic. Here we go. So you should be able to hear.
Our climate and nature are in crisis. People's health, homes and businesses are suffering. Our wildlife and our natural environment are under threat, and young people are worried about their future. We can't carry on burning coal, oil and gas and continuing with high carbon activities that fuel climate change. We need urgent action to reduce the risks from the climate emergency. Yorkshire and Humber Climate Commission has proposed 50 actions that will not only help make our region safer and more sustainable, but make it a happier, healthier, fairer and more prosperous place to live and work. But to make that happen, we need everyone to play their part. That means big organisations and institutions taking the lead. It means putting climate at the heart of everything we do. It means educating ourselves and our children and rethinking how we measure progress. Crucially, it means making sure that our actions to tackle climate change actively help to reduce inequalities too. It means doing what we do best in Yorkshire, cracking problems with brilliant ideas and innovative solutions, making the most of our diverse talents and sharing all the amazing work already happening, attracting investment to fund all sorts of green projects, and seizing the opportunity to learn new skills and create new jobs. Lots of jobs. We can't prevent some climate change from happening, but our beautiful Yorkshire landscape can protect us if we protect it and partner with nature. We need to wise up about the risks, make plans to adapt, prepare our food and farming for future change, protect our businesses and create resilience across our communities and our infrastructure. We must cut our emissions of greenhouse gases too. The Yorkshire and Humber region has a target of reaching net zero emissions by 2038 and showing significant progress by 2030. That needs to include emissions from aviation and shipping, as they are an increasing part of our carbon footprint. We can achieve this target by reducing our energy use, investing in renewables, insulating and retrofitting our homes and buildings, choosing sustainable transport, protecting peat bogs and planting trees, lots of trees, and addressing what we buy, consume and waste, from food to fashion and flying. Our climate action plan has lots of big ideas. We've already consulted with hundreds of people, but it's important we all get a say in where we go next. We need your help to spread the word, create a positive vision, and bring other people, politicians, businesses and communities into the conversation. Because we think Yorkshire can proudly lead the way, showing what can be achieved when we all pull together.
So a brief introduction as to what our strategies and things that we're looking at. So who are we? We are a group across the whole of Yorkshire, and we're created out of the back of the Leeds Climate Commission. And as the Leeds Climate Commission established quite quickly, we need to work regionally and we need to work at a national scale. So as a commission, there's a group of about 50 of us, leaders within different fields, from schools to UC, looking at the water authorities, looking at the energy sector, so national grid, power grid, and through to the gas networks, but also looking at businesses and different local resilience forums across the region. So we've got all the councils involved as well, and we have a group of different leaders from the public, private and third sectors. So as a commission, we are working at a regional scale and a local and a very, very immediate regional, very, very localised scale as well. So we have a different set of elements within the Commission. We have a leadership group, we have a group that looks at national policy as well as regional policy, and then we have various different panels that look at climate resilience and net zero working groups, as well as looking at the communities, future economy, land waste and nature, as well as research. And it's all supported by the Secretariat based at Leeds University. So we're really ambitious with what we're wanting to do, and we want to engage as many people as we can across the region. And all of these different elements have the structure that's embedded as part of this. So the main commission has all the different groups, and we're all invited as to get involved in the various panels across the board. So those different elements are looking at what we can do, and we're looking to create a State of the Region report, which will feed into all of this. Now, you may be thinking, why are you talking about this on a health type of thing? Because health is a part of this very, very big agenda, and it's across every single part of the Yorkshire and Humber Climate Commission's strategy. So we are a really key part of this as well. So what are our key aims? Our key aims essentially are to look at what we can do to foster climate resilience and adaptation to the climate risks and the impacts across the region. Really, really key, as Yorkshire is set to be one of the worst hit areas in the UK, with rising sea level, floods, heat waves. And we're looking at what we can do to drive everybody towards a net zero and carbon emission agenda as well. But we also want to ensure that we take everyone with us. So we want to encourage a just and inclusive transition and make sure that we don't leave anyone behind, and we make sure we address all the inequalities. A key part of everything that we're working at within the various ICSs across the region, as well as addressing health inequalities that we're looking at. But we also want to promote climate actions as well, and kind of ensure that we embed that in natural capital, natural biodiversity aspects, and we use nature and we work alongside of nature for everything that we're doing. The plan that we've come up with is based on a huge stakeholder engagement programme that we looked at, and we worked with around 500 people across the region. Oops, sorry. To look at what we could do, what everybody wanted to have embedded in the plan. And it's very positive, it's constructive, and it's got lots of actions embedded in it. So we're looking at how we can get people engaged throughout the entire process, and look at specific actions that we as the commissioners and the Yorkshire and Humber Climate Commission can actually work on and embed. It's also a living document, and we want to carry on developing it as we go through, and work with everybody to ensure that we kind of improve it as we're going through. We've got lots of different strategies throughout the next 3 years, and we're looking at various different parts of the agenda, and we'll be issuing various things as we progress through. So we have a framework for change, which many of you will already recognise. We acknowledge that there's a climate and ecological crisis, and we're at the core of this, and we're also at the core of what we can do. We want to create a positive vision for sustainable region, and look at what we can do for incorporating everybody as part of that agenda with a just transition, ensuring that we've got citizens engagement. So we've been working with various citizens forums across the region. We're looking to embed a climate leaders pledge, which I'm sure that Rosa can touch on shortly, which will also include looking at what we could do for climate outreach and education through various climate literacy types of packages. We're also looking at what we could do for embedding it as part of our economy and making sure that we've got a green economy in the region. But there's also a really key part of this, which is looking at nature financing and climate financing platforms that we're looking to develop for the region, which will help encourage financial investment in the region as well as building up innovation. We want to have a blue-green infrastructure plan and look at having a regional climate observatory that will kind of go alongside of all of these elements, as well as adopting a sustainable progress index, as well as looking at how we can work with national policy and help improve that. And Andy, who's our other co-director, is also working at a national level and feeds back in with various strategies that are going on at a national governmental level. So climate resilience is a really key part of that, and for our region as the integrated care systems, we're also it's one of our key agendas this year. So we're looking at what we could do to develop climate risk communications, improve and work with organisations to look at climate adaptation plans, promote resilience and well-being and health aspects that come out of all of those elements, as well as ensuring that we get resilience embedded in everything that we're doing. We work with the Farmers Union, and they are very keen in ensuring that we've such a rural area that we have across most of Yorkshire. We have that embedded as part of the change programmes that go on. And I'd really recommend watching our last commissioners meeting last week with one of the farmers who's adapted to looking at more climate resilient farming and a no-till process. Really fascinating to look at. But we're also looking at what we can do to promote nature-based solutions and blue-green infrastructure, as well as climate resilience in business and industry. Lots and lots of really key elements that we need to look at, looking at for flood and emergency recovering programmes, as well as looking at sea level rise. It's going to be a big challenge in the next 50 years, especially around the Hull and Humber region. So we need to get some elements in progress at the moment to kind of assess that. Net zero targets. We've been working with the working on a strategy to look at aviation and shipping for the region, and we have a statement piece that's been issued or set to be issued shortly, relating to Leeds Bradford Airport and expansion of airports and how they play moving forwards. We've also looking at introducing 5-year carbon budgets, which would be a really interesting process, I think, for many organisations to look at what they can do to reduce their carbon impact. But we're looking to work with the energy networks and decarbonising energy across the region, as well as community energy. So there's some real potential to look at having a smart microgrid network across the whole of Yorkshire that might work at a local scale and a community scale. There's also a real opportunity to look at green hydrogen across our region, as well as what we can do with carbon capture and utilisation and storage aspects as well. And then looking at what we could do for retrofitting our buildings, really key to ensuring the fuel poverty that we're set to endure in the next few months, and how we can help our population kind of look at shocks that come to the system like that. There's some real opportunities with active travel, public transport and low emission vehicles. And we're looking at what we can do to promote the 20-minute neighbourhoods across the region and what needs to happen in order to invigorate that. There's also some real potential to work with net zero businesses and infrastructure, as well as the food and farming industry, as well as looking at what we could do for nature-based solutions and how we embed that. So for us within the health sector, we've been running some sessions, and we're keen to work with anybody else who wants across the region to have the bigger conversations about how we can get this embedded. So health runs through every single element of our climate, the Commission's agenda, looking at communities and how we engage with the communities on the climate agenda. But it also looks at policy, the climate resilience, net zero agenda, as well as land, water and nature through the huge amount of land that we own, but also how we can influence the local communities we are situated in. But we've also got some really key things that we need to address, which is how we deal with future economies and how we can research what is set to affect all of our communities as well. So we've been working with health professionals, develop the outline strategy and how we address, so I'll just read this out because it's much easier, to address the climate and nature as well as health wellbeing agendas, and then also work to address and look at what we need to do to tackle the issues for vulnerable people in our society. So we've had our first few meetings with the climate resilience panel, and the health session highlighted that the green plans are in place, but there's a real glaring gap with adaptation and resilience for the region. We also need to assess the spatial planning, so how we are working within our sphere in the health industry, and how we can work with other sectors as well to improve what we can do. So looking at green social prescribing, looking at the agendas for our strategies, what we could do, our procurement, working with local farmers, and then also at the same time understanding how climate resilience relates to the average person on the street and how we can embed that in our health strategies, and understanding how we communicate the future to many. So for all of us, you will have seen this graph before. Climate change has a direct impact on the health sector, and it's no more prevalent than it is. It's of high precedence here in Yorkshire, because an increased rainfall has led to and does lead to flash floods, surface water floods, which at the same time is impacting our services from the ambulance services, GPs, through to acute trusts, as well as the mental health trusts, through mental health, anxiety, injuries, infections, waterborne diseases, and longer term, the change in the climate will have an impact on vector carrying insects as well. Storms, high winds, heat and drought are having an impact. This week we've been affected by all of those, and I'm sure at some point we'll be affected by surface water flooding and flash floods as well. All of these have a direct impact on the patients that we are seeing, and a 1 degree temperature rise, which at the present trajectory we're on, we're looking at an 8 degree temperature rise. A 1 degree temperature rise on a daily basis has a 1% increase in the amount of submissions into hospital. So when we start looking at how climate change is impacting the health sector, it's already happening. We need to work out a strategy to work alongside of what we can do, and the Yorkshire Humber Climate Commission is starting to assess that at a macro scale, whilst we in the health sector are starting to look at the minutiae of what we do on a local scale. So we're here to help, and we're here to kind of have the bigger conversation and work through the connections that we need to have as we progress through our climate impacts across the system. So I'd highly recommend having a read of our 50 big ideas that we've got, and the Yorkshire Humber Climate Commission action plan is there for you to have a read through. And we need to work with you guys to work through the health sector agenda, and we will have a discussion at the end. So if there's anything you feel you really want to have more conversations about, then please engage with Rosa and myself. I will pass over to Rosa.
Thank you, Alexis. That's brilliant. Yeah, just before we move on to Rosa, Alexis, we've had a couple of requests for your slides. So if you're willing and able, can you send me the slides and I shall send out to everybody on the call. And then, yeah, there's a couple of other questions which we can pick up after Rosa's session, and that Rosa might be able to pick up during her presentation anyway. So Rosa, if you'd like to introduce yourself and then just, yeah, take it away. Thank you.
Too many buttons, isn't it? That's the thing with these things. Okay, so hi everyone. My name is Rosa Foster and I work for the Environment Agency. I'm on a part-time secondment to Leeds University as co-director of the Yorkshire and Humber Climate Commission. So I work alongside Professor Andy Goulson, who until recently was the director of the Climate Commission. So we share that now. So I think actually just based on what I've seen Alexis has shared and some of the questions, I'm actually going to share, I'll put them together into one slide deck and send them to you, Emma, for circulation, but I'm actually going to share across 2 different slide decks now. So I think the first one I'm going to drop into is just to clarify actually what I think our adaptation challenges are. And some of the sort of context for that. So I'm not in doing this, and you can shout now if like everyone on this call gets what climate change is and what it means. But I'm sensing that maybe actually we're all in different places on that. So I'll just share a couple of steps on my journey towards understanding what we need to do around adaptation and resilience. And then and then I'll move into the Climate Commission stuff. So I'll just share the screen first of all. Okay. All right. So I think our key adaptation challenges are actually human ones. So they're about acknowledgement and acceptance, our ability to respond at the scale and pace required, and about being clear on the ownership and accountability. So yeah, and I think that I do want to say at the start here, I think that the green plans that you have in the ICSs are across the region are really brilliant. They're a great starting point. But as Alexis said, when we've had the discussion at the Adaptation and Resilience panel, what was very clear was there's sort of groundswell around the people producing the green plans, and therefore that support in all facets of the healthcare system or health well-being, trying to get the language right. If you're not in the sector, you sort of pick up on terms and don't use the right one. So forgive that if I lead you down an alley with the wrong term, then just say, do you really mean that? Because I'm trying to learn the language. Okay, so moving on. So I don't know whether you guys have come across the climate stripes before. So these were developed by Reading University, actually as an idea I spotted on Twitter recently. A climate scientist lady got a bit geeky about a crochet blanket she was making for a friend's baby, and that is actually where the idea of the climate stripes came from, believe it or not. But so it's a very effective communication tool of showing how the world is actually warming. So each stripe is a year, basically, of the global temperatures. So you can see that they're warming, and you can cut the data for some cities in the UK. This is the England climate stripe. You can do it for the world or a number of countries around the world. But nonetheless, the data is compelling, and that's the thing to take away from it. It's absolutely compelling, and this is a really visual way of showing the scale of warming that is going on. One of the things that I've reflected is, like people say 1 degree change, and Alexis was sort of alluding to that with some of the impacts on the healthcare system, is around actually what does 1.5 degrees mean? Like that, how do we scale, like the scale we go across around the degrees is is pretty big, isn't it? We go from minus temperatures up to 30, and so what does one degree in the mix of that actually mean? Well, a colleague of mine was telling me the way that they think about it, and it honestly made my hair stand on end actually when she shared it with me. So I'll share it here because it relates to the human body. So she said, well, the Earth is actually a closed system, and actually then if you take it as a closed system, so is the human body. So the human body is a good analogy therefore. So then if you look at temperature increases, if you're 0.5 degree, like you might be reaching for the paracetamol, feeling a bit under the weather, right? If you go for 1.5 degrees, you're feeling pretty rough, you maybe shouldn't be in work. You might be trying to soldier on, but you're definitely adapting and trying to mitigate, aren't you? Definitely taking some medicine, drinking lots of fluids, maybe think about not spreading it around with your colleagues or what have you. 2 degrees increase, 39 degrees, you've got a fever. 2.5 degrees, you're in high fever. 3 degrees increase. Most people, if you're there for, well, yeah, if you're there for a sustained period of time, you're probably starting to go towards A&E. So that for me was a really powerful analogy of actually why 1.2 degrees that we're at the moment matters. So our Earth system, global temperature is now at 1.2 degrees higher than pre-industrial times. So that's the status we're in. We've got, our planet has a low grade fever, and alarmingly, the challenge of responding at scale and pace is that actually the Met Office has just released some stats in the last month that they predict that there is it's 50% chance. Oh good, thanks Emma. I was a bit nervous doing that with health professionals actually. But yeah, it really brought it home for me about what it means. So the Met Office has said there's a 50% chance that one of the next 5 years the global temperature will actually be 1.5 degrees. So the Paris Agreement was trying to stay below 2 degrees. Then following that, there were all the net zero commitments. So everyone was like, we've got to stay below 1.5. Well, we might actually get there. It's a 50% chance we'll get there in the next 5 years. And that really makes me think about the scale and pace that we need to make these changes at now. Like, this is getting properly serious. It's properly serious. So some of the other impacts, this was Alexis talked about, it's not relevant for West Yorkshire and Harrogate directly as a patch, but you know, it's very close by, isn't it? It's very, very close by, and there will be impacts if we end up here. But this is a colleague of mine actually stood in the Humber estuary, and what he's doing is showing you what a 1 metre sea level rise by 2100 would look like. And actually, one, again, slightly alarmingly, one of the figures that, well, one of the realisations of our climate scientist colleagues is that the models aren't actually keeping up with the rate of change. So when we say it will be a metre by 2100, we're not actually keeping up with some of the tipping points that we're starting to see. So we're getting genuinely close to some areas of climate breakdown as a result of temperature increase. And so that this might be a bit optimistic. That's not official. That is just sort of word of mouth from talking to climate scientists that they're starting to wonder actually what this means. So yeah, we need to really think about this. So Baroness Brown chairs the UK Climate Commission, Climate Change Committee's UK Adaptation Committee. And in her introduction to their review of the government's policies, I really like this analogy, that she said very clearly that actually we're just not keeping up with the scale of the change, that now we are, between now and 5 years ago, the gap of preparedness and on adaptation and resilience is wider than it was 5 years ago. And yeah, this analogy that's on screen here about it, you know, that adaptation is the Cinderella of climate change. And I think we've all got a role. We need to all think about, well, actually, what do those climate risks mean for me and my job? How can I have what agency have I got to bring that to bear? What changes can I make? What issues can I escalate or flag to my management, to my teams? What, you know, depending on where you sat, you know, what is it that you can do? And I just think it's really important that absolutely nobody underestimates their personal impact on this. I think it's very easy when we're looking at some of these big organisations and big government policies and machinery and so on, is to feel overwhelmed by it and sort of become inert. And that's actually the worst thing we can do. What we have to do is tap into our communities, and like, there are a lot of people who are in the same place, who are having these realization moments, who are wanting to genuinely drive change and do something different, and that tapping into that sense of collective action is really powerful, and there is a lot of it. So be reassured, this statement is true. but there are also a lot of people, and a growing number of people, who are really trying to step this up. So become one of them if you're not already, and get in there, get in the mix on this would be my sort of encouragement, really. Okay, so that's about that ownership and accountability. So it is one of the phrase that I sort of refer to on this is the trouble with climate change is it's everywhere and nowhere, and it's everyone and no one's. So that's sort of that personal accountability. It becomes really powerful in that space, because you're not trying to save the world. Not one person can do that. It takes everybody doing their bit. So work like, what's your bit, and start small. Don't try and like change your whole department or whatever. Work out what the small steps are and do it incrementally, and build the momentum, build your own confidence, etc. You don't have to tackle it all, because those sort of numbers and things can make you feel like that. I'm aware of that. And I would really encourage, just do what you can and gain some momentum. I think I'll stop sharing there, and I'll just put up my other slide deck, so bear with me a second. Close that one down. So the slide is just one slide I'm going to share now. So there's a whole sort of matrix around the Commission, and lots of different actions, and a web that we're sort of weaving together of how different sessions are like the different panels that Alexis shared there, how they all relate and all the rest of it. And that's my job with Andy and the core secretariat team, to help make sure that the flow of those conversations are right and all the rest of it. I'm not going to go into that here, but just want to reassure you that there's that we have that sense of there is a matrix of conversations that's happening around the region, and that our job is to try and optimize it. And if we get it right about 60% of the time, we're probably smashing it out of the park. So it's tricky. So that's how we're kind of approaching it. So what I wanted to share with you is this slide, which is where we've got to in the adaptation and resilience panel. This is really to share. So Alexis talked about the 3 pathways to impact of the Commission overall, and this is the adaptation and resilience panel, kind of taking that really nice, clear way of thinking through that matrix, and working out what our contribution is to those. So Alexis talked about policy for the Commission overall, and one of the main strands we're going to work on in adaptation and resilience is developing a programme where we help and support a number of local authorities, like maybe 8 or 10, to work through an adaptation programme. So the Local Government Association produced a brilliant toolkit, adaptation toolkit. So we're going to help those local authorities work through that programme. Inevitably, the public health section of the service of the local authority is going to have to do that work too. So it will involve all the key services of a local authority. And we're hoping to do that, like I say, across 8 or 10 together. So again, it's about building that sense of community, collective action and momentum as we go through, as well as delivering the work. And those local authorities at the end of that programme should have an adaptation programme. The way it supports policy is we'll learn a lot through that. They'll have a product at the end of it, and hopefully change ways of working, and new actions that they need to lead on and develop, and that's for them. But we'll learn a lot through that process that will influence and support, enable either regional leadership or national debate around actually what do we need here for this challenge. The Health, Adaptation and Resilience Initiative is what I'm going to finish on. So just very briefly, the last one there is reframing climate adaptation. And this is about recognising that it's really hard to talk to people about climate change, because you kind of have to look at the reality of it, which is quite scary. But we don't want to do that in such a way that it like I say, it sort of destabilises people, makes them switch off, or just think, well, hang it all, I'll just live my best life and I don't care what comes after, because that's all, you know, that's not what we're after. Those aren't the right responses for the collective good. So this is about sort of thinking about, well, what are the different personas from a communication specialist perspective? What are the different personas? How do people respond in different situations? And maybe what are those scenarios? And clearly, this thinking and that work will impact the health and adaptation conversations, and it will impact the local authority work. It'll probably impact a lot of the net zero stuff too. I think it's a really, really fascinating strand of work, and it's about being able to communicate climate risk effectively to engender change. So the one I'll finish on then is the Health Adaptation and Resilience Initiative. At its heart, the action, Alexis put this up, the action that this is looking at is developing that outline strategy where we look at the health and well-being VEN, or part of the VEN, the green and blue infrastructure VEN, which is really the environment, like physical environment, a healthy, thriving physical environment. That's what that means. And where those two areas overlap, and we're talking about the most vulnerable to climate risk. So from a health perspective, that probably has a pretty strong alignment with health inequalities. But from from the environmental perspective, it's about climate risk. So it's we need to try and get our language right around that. And we're reflecting on that. So we do want to produce that strategy, but as ever with the strategy, it's the journey on the developing it that is the most powerful thing. So we're being really mindful of that. And one of the things we're thinking about doing, it'd be great to get feedback on it today, is having a summit, a health and climate summit, potentially in South Yorkshire, in Sheffield, where we have a day where we really work through all these different the different angles of it. So it'd be plenary sort of sessions and workshops, and be quite active to pull that all together, and again build that community and the networks, connect the networks that are chipping away on the placemaking side, and the people who live in those places, and the people who support the people who live in those places. So yeah, that's that one. I can see some questions coming up, so hopefully I'm happy to talk a bit more about green blue infrastructure. Emma, you put in the sort of information from West Yorkshire Combined Authority, which is great. There's a lot of information from Natural England as well, so they're leading on so the government's got an environment plan, and we've just passed the Environment Act, and within the Environment Act there is a new statutory process coming out, which is called nature recovery strategies, and at their heart they're all about really trying to create trying to make sure that nature recovers. So one of the prices we've paid for our lifestyle today is a degrading of our environment and biodiversity, and a lack of resilience there, and so we need to recover nature, but we need to do that in the context of climate change, and Natural England lead on that. So if you have a little look on the Natural England website, I can dig out some links, then yeah, I can have a go and share them, but I'm sure you'd find stuff there that would be really useful. Sunanda, you've asked both adaptation and resilience initiatives require significant investment. They do. What is the investment strategy for the region? It's a brilliant question that I don't know the answer to, because I don't think we're thinking about it that way. I don't think it's framed that way. So there's infrastructure planning. Mayor Brabin, for like the geography of this call, spoke at an event I was at last week, and she was very clear that all of their capital investment programs around place need to consider climate, and they need to be resilient to future climate risk. But that's all new stuff. So what about retrofit and adaptation of existing infrastructure and stock, about making our towns and cities more resilient? You know, there's a lot to do there. The director of place from Combined Authority policy, I think actually she is, Liz, came up to me at the end of the session as well and asked the question like, well, what's the scale? What's the scale of the challenge here? Like, what is the scale of investment that's needed? And honestly, I think going back to Baroness Brown's point, is the fact that we don't actually have ready answers to that shows where we're at with this. And that's our challenge, is to work together to work out what that means, what the answers are to that, what is it that we need. We've got some stellar examples in West Yorkshire though. So again, in terms of that thing of having heart, we've got people who do know, lots of people who do know what they need to do. Bradford have got some brilliant European funded schemes, retrofit schemes going on in different parts of the city. We've got some great work going on in Calderdale. Leeds has done their best to incorporate natural flood management in alongside traditional capital schemes on a huge scale, largest in the country to date. So, you know, we've got some really great examples, and, you know, Harrogate as a council is also really leading the way on this. So, and the fact that you guys are having this conversation, you know, it's there's a lot of energy here. What are the quickest and biggest wins? Well, those are two different things, aren't they, Alison? The biggest aren't necessarily the quickest. So I think the quickest win are the ones that you can do they're the ones that you can do immediately, aren't they? So the ones where if you stand and look at your work from a climate perspective, I think just starting to do that is your quickest win. Carving out the time in your day-to-day work and thinking, okay, actually, what can I do on this? Making sure you've read the green plan, that you're supporting that within your sector. Are your partners talking about it? Can you bring like net zero or climate adaptation into every team meeting? You know, there's some really basic things where you can just get the conversation going and get people thinking about it. I think that's the quickest win, making sure that people are really thinking about, actually, am I thinking about this in the future? Or am I doing something that's based on something that's happened in the past, and therefore it might not be resilient in the future? So how do I need to change my thinking on that? And then asking the questions, well, what do I need to be able to inform that decision? And that's where we're at with the thinking, and we won't always have ready materials. There is a lot, and we do know a lot of what we need to do. I think, like, it's not like net zero where the tech isn't necessarily there, but actually a lot of the tech is there on net zero. But you know, we know what a climate resilient place looks like. We just need to fund it and get that political will behind it. Biggest wins, well, it's the money, I think. Capacity and money. Okay. Love the collaboration between us all and how we can help each other. Exactly, Shane, who's had to drop off. So I'll stop there, but happy to take other questions. I was just trying to respond straight away to the ones in the chat. I'll stop sharing. Sorry, I realised I'm still sharing. Stop that.
Not a problem at all. No, that's brilliant. And I think there's definitely quite a lot I'm going to plagiarise, I think, for things internally. And I'm sure other people will do. Just before we jump into some other questions, that somebody asked about, I'm scrolling back up. Where can we find out about areas that will be most affected by climate change? And then I did put a couple of links in the chat, from the Met Office and Coastal Resilience, but I don't know if either of you have got any other links or suggestions of where we can find some really good information. I
think those are really good places to start to look at your geography. There should be, I think it would be worth it. So a lot of local authorities are reviewing their local plans at the moment across the region. I think something like 16 out of 24 local authorities in Yorkshire and Humber are reviewing them over the next 12 months. So I think having a good look at your local plan, so there will be climate aspects incorporated into that as well. So it's there, it's just not prominent and it gets overridden. That's the thing, like it is there. There are requirements, they're just not like statutory enough, or statutory in some cases.
One of the other more orientated health platforms is the SHAPE Atlas, which is really useful to have a look at for flooding, but it also, you can overlay GIS layers which look at various things like health, population, health, the issues that affect certain areas, so if there's fuel poverty, and so you can actually see future proofing elements that need to happen, as well as floodplains. But if you wanted to have a look at something specific to one site, there's a platform called EnviroCheck, which means that you can actually have a look at, they've used the Met Office UK climate projections up to 2100 to look at exactly what will happen according to each different scenario. So you could actually see your flooding, your heat wave, your drought problems, and specific to your site and with a radius that comes out from that. So there are different platforms that you can have a look at to look at that, but building resilience into our estate is a really key part of it as well.
Thank you. I mean, obviously, so I'm sitting in Bradford, and you know, we're not near the coast and stuff. But both of you, I think, kind of touched on things like about the coast and some issues that we might have if people are displaced. And I do think that whilst those of us in West Yorkshire might not be, let's say, as affected by some impacts of climate change, I think if we then see kind of migration inland, that's obviously going to impact on our services, isn't it? And particularly those of us in mental health, where we don't have a huge amount of capacity anyway. If we're then having to take people out of area, it could be a big issue. But yeah, there's Naomi's put in another question, which I guess Alexis has probably directed at you, about some of the biodiversity stuff and a green infrastructure. And I know previously we had discussed, hadn't we, about the idea of having a sort of NHS space, like you know, that perhaps everybody was contributing to. And I don't know if there's anything more you wanted to say about that one.
Naomi, do you want to come in with your question?
Yeah, sorry, it was most unfair. It was directed at Alexis. Alexis ran a fantastic biodiversity in the NHS event earlier this week, and one of the things that came out of it was Natural England's green infrastructure mapping, and so I spent an evening this week putting my home address and all my work addresses I could think of into it, looking at the mapping of, you know, kind of infrastructure, etc. And it's one of those examples where everybody is doing their own bit and it's great, but we almost need to overlay all of these mapping systems in order to get a full picture. And I was just thinking that although those two links you put up were really, really good, that one from Natural England might also be a natural one to go alongside it, no pun intended.
Yeah, I agree. They've got some really amazing stuff that's coming out of Natural England, especially looking at the corridor potential for greening infrastructure, and how we can do that. I've got that. Liam would be a great one to have come and talk about it. He's part of the commission as well. So it's something that we need to incorporate, and we've excluded its biodiversity from green plans. So I think we need to incorporate it a lot more, embed it in what we're doing, but also our kind of wider image of the way the NHS and healthcare system functions within our sphere, because biodiversity is really key. We own a lot of land. If we can work with mental health and all the rest of the kind of connectivity, it can really help.
And that, I think, was the point I took away from that session earlier in the week, is quite how much land as the NHS we actually own. I think I hadn't appreciated how, you know, especially as you say in Yorkshire, we have great tracts of land that are NHS property. So, yeah.
Rosa, do you want to come in on that one?
Yeah, I do. So I guess it's just it might be a useful way of reflecting on your organisations, actually. So I don't know if you've come across the sense of the concepts of anchor institutions, and forgive me if you have, but I think it's a really powerful way of thinking about your role in a place. So obviously, the NHS and the healthcare system employers are really big employers, aren't it? Like absolutely massive. So the footprint socially of all of those connections, of all of those employees, is really big. And also, yeah, your physical assets that you have in places, just like Naomi was saying, huge tracts of land, big buildings, green roofs, solar panels, you know, the retrofits. Are hospitals ready to be in a place that has like heat waves for 2-3 weeks in summers? It can deal with storms and not get flooded, you know, like, is the infrastructure of those properties resilient? So I think that would be my only caution with looking at some of the flood stuff, is that it's historic. You know, so the modelling is brilliant. The modelling that the Environment Agency does on river flood risk and coastal flood risk is really very impressive, but it is modelling, and it isn't 100% perfect. Of course, it can't be. The biggest challenge we've got is surface water flood risk, which actually isn't the Environment Agency's statutory responsibility. It sits with local authorities, and they do They're doing a lot of work, particularly in West Yorkshire. Actually, they've got a special innovation adaptive project looking at surface water flood risk. So how can we do sort of emergency sort of warning and informing that like the EA does for river and coastal risk? Can we do something similar for surface water risk? So that's basically rainfall that doesn't get into the drains in time. Can we do how can we forecast it more effectively, and also what do we need to do in terms of our infrastructure? But yeah, sustainable urban drainage in and around hospitals, that inevitably, if you do that nicely with green infrastructure, those are nice places for people to go and sit and heal and recover, and look out the window out and enjoy. And we know, don't we, there's lots of evidence of the health benefits of that. And it makes your property more resilient and does do a bit for biodiversity. It's those kind of, and it sounds like, for me, it sounds simple, or like those are just such rehearsed ideas. It's like, why aren't we doing it? And I think it's money. But like, that's what I mean when I say we know what we need to do for this, for adaptation. We know it. We just need to prioritise it. Naomi, you want to come back in?
I was just thinking, something you just said there, Rosa, just linked in with something. I did a piece of work I work in a mental health trust. I did a piece of work for our risk and safety group recently about lessons learned around Storm Dudley. So it was actually around community mental health services and how you have, the fire service with their list of vulnerable people who they're trying to reach and make sure they're safe. And then you have, other charity groups with their lists of vulnerable people. But again, it's one of those scenarios where we need to join all these lists together, because one of the big things that came out of it was not only was there the mobile phone stations were overflowed, so there was no signals, so that you couldn't even phone and do a phone consultation with somebody for a mental health appointment. And obviously, if they have a mental health condition, that means they're having community therapy. The circumstances of the storm and the flooding, etc., is going to add more to whatever it is they're experiencing. And so we actually did a piece of work that was kind of a desktop audit, but it was kind of reviewing all of the things that came out of Storm Dudley and what we would do differently in terms of adaptation going forward. Most of it was about communication piece, to be fair, joining up, various groups who were all doing their best, but are potentially either leaving gaps or stamping on each other's toes because we haven't got that joined up list kind of at the moment. And it was just really interesting to actually pull together the day-to-day, kind of what it actually means in terms of, none of us think, I live in an area that's flooding on a regular basis, and I, drive through large puddles to and from work, but I don't stop and think about what it means for or those kinds of scenarios. And I think that's why some of the work, another thing that's happened this week is the flood stories work. I don't know if any of the people who were on this conference were on the flood stories work earlier this week. That was again very similar. It from the point that's all they can afford, etc. So there's just lots of layers that all kind of link in together.
I don't know if it was just my end, but I think we lost you a little bit, Naomi, there, but I think everyone got the gist about the flood stories sort of as the last of the thing that you said, wasn't it? And I just wanted to come back on that. I was doing carbon literacy training yesterday, and we had somebody from South Tyneside in Sunderland on our course, and she was saying that they recently had a patient try to discharge themselves because the ward was too hot, and they were willing to sort of to do that. They felt they had to do that extreme kind of event, and you think that's Sunderland. We always think about it being the southeast in London, don't we, in terms of overheating, and like if actually Sunderland hospitals are feeling or patients up there are feeling that, then yeah, we definitely need to make sure we're thinking about it.
Yeah, and I guess the concern is with that is that the instincts, or we're putting aircon, but it's like, as we know, it's like, where's the energy for that? And are we just going to make that cycle worse? I guess, Naomi, exactly. I'd be really interested if there's any outputs from that session that or that work you're just talking about there in terms of reflecting on Storm Dudley. Be really interested in seeing it. and also that aspect of all those different linkages. That's exactly the sort of thing that we want to try and flesh out in this sort of health and climate sort of summit idea, or on the journey to that and afterwards, is to really bring that to light. You're on mute, Naomi.
Yes, it's all right. I realised I was. It's probably a good thing. If you pop your email address in the chat, I'll send over the report so that you can have a look at it.
Yeah, fab. Thank you.
Thank you, Naomi. We've probably got time for one more question if anybody wants to put their hands up, and while we're waiting to see if anybody does have another question, I shall just tell you about some future events, because there's been a bit of talk about Natural England, and Liam, who was actually name checked, is going to come and speak to us in a month's time, because we've got a session so we've got a session in 2 weeks called Sustainability for Young, Old and Everyone in Between, where we're going to think a bit about education and what's being done, I suppose, to make sure that our people coming into the workforce have a wider knowledge, which I think will probably help embed it, and also then thinking about sustainable palliative care. So if that's of interest to anybody, please come along on the 8th. And the one after that, which is on the 22nd of July, is about how our places will change, and is highly relevant to this session, because we've got Liam from Natural England talking about nature restoration and biodiversity net gain. We've got somebody from West Yorkshire Flood Innovation Programme sort of talking about all the work that they're doing, and we've got somebody from Sustrans coming to talk about the sort of idea of the 20-minute neighbourhood, and I think Alexis sort of touched upon that. So that would be a really natural fit if people are interested in today's session, so please do. This link, actually, the same link will work for these 2 future sessions if you don't get around to actually signing up. So
I was just going to say, Emma, that flood innovation programme, that's what I was talking about when I was talking about the surface water flood risk piece. So that's really great. What a fabulous follow-on session. That's excellent. Yeah,
it's as if it was planned.
Yeah, well done. I mean, these things are hard to pull off, so
yeah,
it's good. Take it, yeah.
It seems to have just fallen that way. But I did put a link in because I was on a Manchester climate change call earlier this week, and they spoke about a sort of side shoot of some work that had happened at the university called this sustainable, which is quite a hard word to say. So I've just put that link in, which if people are interested in sustainable urban drainage, that might be of interest. That waffling from me does bring us up to time, so thank you very much, Alexis and Rosa, for your presentation. Certainly got people interested, I think, in some questions and things. Please do join us for future events, and enjoy your afternoon and have a great weekend, and we'll see you soon. Bye everybody.
Bye.